Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Nicole Bell. Good morning.
Morning. Thank you for having me today.
And so when I first was, reading through your stuff, you're an author, so you wrote a book of what lurks in the woods, and I thought, man, that's going to be a different topic for my normal listeners, so and then you read a little further, educate yourself some better, and we're really going to talk about that from caregiver to advocate, a mission to transform the standard of care. And so and all of this started because of your personal journey. And so can you tell our listeners, a little bit about, what happened and what led you to write the book, and then we'll talk more about what you're doing now.
Yeah, I mean, it's funny calling myself an author because I really am not. I'm an engineer and, scientist by training. But, as you noted, life kind of has an interesting way of throwing things in your path, right? So my husband started really just changing in front of my eyes. It started more with mood issues, anxiety, depression, rage and issues. We went to therapy and he was just really struggling. And then I realized that he was also having cognitive issues and he was forgetting things. We had 2 young kids. He would forget the time to pick up, the children. He would forget the security code for our house alarm. And I realized that he had something really going on. And it was a long journey. To make it somewhat short, he was diagnosed with early onset Alzheimer's disease. And I later figured out, which it really didn't make any sense to me because he was young, he was otherwise healthy, he was doing all the things you're supposed to do for brain health, and he was still getting really sick really fast. And I eventually realized that his condition was caused by multiple tick-borne pathogens. And it really opened my eyes to the complexity of some of these pathogens and how they interact within your body, and the link to a lot of complex chronic illnesses that, people think they get one diagnosis and they have the answers. But the reality is that sometimes you have to dig a little bit deeper and get to the root cause of what's causing those symptoms. And so our journey was frankly quite crazy. And so writing was really a way for me to process it and to share our story in the hopes that other people would learn from what we went through and try and figure out how they could avoid some of the same challenges and issues that we had to face.
So you said tick-borne allergens. Were y'all outside or in areas that, that ticks are prominent, and because a lot of people are, outdoors, a lot of people are not really that outdoorsy, and sometimes you don't have to be that outdoorsy.
Yeah.
One of my granddaughters, my grandkids, her cousin lives on the same property out in the country, so it's not really, it's just there's not a lot of trees, things like that, so you don't anticipate somebody, necessarily, because it's kind of a little wide open, getting things. And um, so when you I guess because you're an engineer, you have some, some backgrounds, because,
Mhm.
I've worked with a lot of engineer clients, so I understand the whole type A personality.
Yep,
But
guilty.
I'm really curious to see. I have it. That's why I know. So, and I'm really curious to know how you found out
Yeah.
about it, because I think that's important for
Mhm.
people that are not aware, how easy it is to get bit by a tick and then
Yeah.
other things occur. And so how did you figure out that's what it was?
Yeah, so it's a great question. And I think a lot of people think, well, I'm not an outdoorsy person. And so therefore it wasn't that. I mean, what I would say is most people that have, Lyme disease, which is one of the top pathogens, actually didn't see a tick and didn't realize they got bit. And so ticks are really small, especially some of the younger ticks. And so it's really difficult to know whether you got bit. Now, in our case, my husband was a big outdoorsman. He was was a hunter. Did all of our landscaping at the house. He had multiple tick exposures. He's lived all over the country, including multiple endemic areas. Although I do tell people, like, ticks are everywhere. So it's not just the Northeast and the Midwest, and actually even the Pacific Northwest. It's all over. And so actually, Lyme disease was one of the first things that we had tested when I took him to the doctor, because of his exposures, because of the research I did just on, Dr. Google. And we had him tested, and he tested negative. And that's kind of what set me on this mission, is because one of the things I've realized as I've dug in as that type A engineer and scientist is that the current standard of care for Lyme disease testing is only about 50% accurate. And
oh, wow.
yeah, a lot of people don't realize that. You go to the doctor, you get a test, you have some expectation that test is going to give you the answer. But unfortunately, in Lyme disease, that's not the case. A positive is generally a positive, a negative is a maybe, right? Because a lot of people, one, it misses the very early stages of infection, which is when the things, the pathogens are the most treatable. But then also in cases like my husband, once you've progressed into the chronic state, your overall antibodies can be suppressed, because that's what it's testing for. It's not testing for the pathogen. It's testing for the antibodies or your immune response. And that's highly variable. And so it leads to a lot of issues, and a lot of people get misdiagnosed. And then I'd say the final thing is that, ticks it's not just ticks, like we call them vector-borne diseases, which vectors are kind of biting insects. So fleas, lice, biting flies, even spiders can transmit some of these pathogens, right? So it's not just about Lyme disease. There's also a host of co-infections. And so my husband also had two common co-infections: Bartonella, which is a bacterial infection, and Babesia, which is a parasitic infection. And so, and the combination of these pathogens can be quite devastating. And we see this with lots of patients and case stories that I've, been exposed to now because of what I do. And so, anyways, to get back to your original question, we tested him at one of the first doctor's appointment. He tested negative. About 15 months after that original appointment, after he'd already received the diagnosis for Alzheimer's disease, my brother actually was the one. My sister-in-law had been diagnosed with tick-borne illness after a whole host of issues on her end. And he was the one that had me convinced to get him retested, because he was saying, I've been doing a lot of research. A lot of his symptoms are very correlated in what's going on in the literature. And that was when I figured out that not only did he have Lyme, but he also had these two other co-infections. And that's kind of what set us on our journey to, get to the root of what was going on with him.
Is it treatable at that point?
So the later that you are in diagnosing, the harder it is to treat. And there's data that shows out of Johns Hopkins University that for Lyme disease, even a 30-day delay in getting a diagnosis can over double your chance of developing chronic symptoms after treatment. Because a lot of people get treated and then they still have symptoms. And then the question is, what's going on and why? And so the longer that you wait, the harder it is to treat. And in my husband's case, he had most of his symptoms were neurological. He actually didn't have, a lot of people, when you think about Lyme disease or some of these co-infections, you think about, joint pain, rash, fevers. He had none of that, right? It was all cognitive. And, so the bacteria and now the protozoa were deeply embedded in his brain, and that's a hard place to treat. And so, to make a long story short, again, his journey didn't end well, because he did respond up and down to treatment, but the cognitive piece really never got better. And so he continued to decline cognitively, and he ended up passing away in January of 2022. And
I'm so very sorry.
Thank you. And I think had we diagnosed earlier, had we been able to get him treatment earlier, then I think that the outcome could have been quite different. And, and that's what has kind of set me on the journey to provide better answers to patients and caregivers out there.
So how did this tragedy, drive your mission today?
Well, if I think about again, as an engineer, right? What's the biggest problem? What's the best problem to solve, right? And everything went wrong in that first doctor's appointment when we got that misdiagnosis, right? And when you find out as a patient and a caregiver that the tests that you're giving and that you're deciding literally life and death, to yourself or to your loved one is only 50% accurate, it's kind of maddening, right? It's like, how can that be the case? How is that possible? And so I started digging into the research and understanding how the tests work and why that's the case and the history of the development of the test. And there's all sorts of things to unpack there at the scientific level that I won't dive into too deeply. I think the main thing I'd like people to take away is that it's an antibody-based test, right? And that's complicated because that just says you've been exposed to the pathogen. It doesn't say you're actively infected. And it also is hugely variable because we're all very different, right? And we all have different antibody responses. And so it leads to a lot of variability in your testing results. The challenge is, and if you think about COVID, right? If you want to know if you have COVID, you don't get an antibody test, right? You get an antigen or a PCR test that tells you whether or not the pathogen is present in you at the time you're getting tested. But the problem is these pathogens are different and they're very low abundance and they're in super small levels in the samples that you would take out for testing. And so really you need to increase the sensitivity of those techniques in order to fix the problem. And so for me, it's like, that's it. That's what we have to do. We have to figure out how to get more sensitive tests so that you can get a test that actually gives you a result. And so I started looking at all of the specialty labs and all of the technologies out there and came across people that were doing that. So in a research environment and now at the company that I'm at, Galaxy, they were really trying to solve that, what I call it's direct detection, right? How do we directly show that the pathogen is present in your body? And so they had fantastic science and researchers that have been doing work on the university level since the 1990s on some of these top pathogens. And so, I was like, this is what needs to fix, because if you don't have an accurate diagnosis, you're never going to get accurate treatment, right? And even with my husband, I was guessing as to whether or not he had Babesia because I had antibody tests that were positive, but PCR tests that were negative. And it's like, and he wasn't having the traditional symptoms of Babesia. And now I know because I donated his brain to science,
Wow.
I have images of Borrelia in his brain, and I have PCR results of Babesia in his brain. And so the pathogens absolutely were impacting his brain tissue and causing massive inflammation, which was leading to his neurocognitive decline. And so you shouldn't have to, patients shouldn't have to wait for an autopsy to get their answers, right? Like that is not okay. And so that's the mission that we have at Galaxy, is to change the standard of care, to provide better testing solutions, not only for Lyme disease, but for some of these top co-infections, which are challenging, and to give patients better answers, and then to make it mainstream so that, everybody can get those answers quickly, because the sooner the better.
So you've been a caregiver, you're now a widow, you're now a single mom.
Yep.
And so what have you learned about mental health through all of this?
Oh my goodness. And there's so many levels I could answer that question. There's my husband's mental health, and then there's my mental health, right? Because it was a journey on both ends. I think the first thing that I've learned, and I learned this firsthand, and now I'm learning it through the research, is that mental health can be linked to pathogens. And this is something that I would not have believed if I hadn't seen it firsthand. But my husband was the most logical. He was also an engineer, the most logical, straight thinking person that you would ever have met. And all of a sudden, as I said, most of his presentation was kind of more mood-based, but then eventually became kind of neuropsychiatric. So he was hallucinating, and he was constantly anxious, and he was suicidal and depressed. And I would see he thought people were living in my woods trying to kill us. And he was having visual hallucinations that, at one point, that somebody was in our woods swinging from the trees in a vine with a machine gun, right? And so it gave me a whole separate view of mental illness, because I literally saw his biochemistry in his brain was changing because of these pathogens. And I could see it in his behavior, which made no sense compared to the man that I knew and that I married. And now I see, our researcher, our founder over at NC State, they've done studies and they've got case stories of people who have been diagnosed with schizophrenia and then get diagnosed with Bartonella, which is one of the pathogens that my husband had. And then they get treated and their symptoms go away.
Oh, wow.
Right. So it's a whole different view on mental illness. And then they did a follow-up study with at NC State and UNC. They looked at 17 schizophrenia patients and 65% of them were positive for Bartonella. They did a follow-up study with over 100 patients at Columbia, and they found that almost half of these schizophrenia patients had Bartonella. And so when I think of mental health, one of the things I'd like to enter into the discussion is a pathogen causing the behavior, right? And I think that there's a meaningful percentage of folks where the pathogen could potentially be the cause, and it could be reversible with the proper treatment. And so my whole view of mental health has changed. And so that's the answer from a caregiver perspective. But then there's also the caregiver perspective of, that was literally the hardest thing I've ever done. I've been an entrepreneur my whole career. I've been an engineer. I've done some really hard things professionally. Nothing was as hard as caring for a dementia patient. And it was just absolutely devastating, and it nearly broke me on a lot of levels. And so I have the utmost empathy for people that are in the midst of it. And I always encourage people to give themselves grace, because for a type A person, you're trying to do all the things and it will eventually break you if you don't, concede and give yourself a little bit of grace in the process.
Yeah, definitely. So what are the challenges in tick-borne disease management?
Diagnosis is the first, right? Like I said, if you don't get an accurate diagnosis, then you're never going to know what's wrong. And what we're finding with a lot of the chronic cases is it's generally more than one thing. It's not just Lyme disease, it's Lyme and a co-infection. It can be just a co-infection and not Lyme. It could be other exposures like exposure to mold or other toxins or things or other infections. COVID has exacerbated a lot of people's chronic conditions and tick-borne disease. And so I think the first thing is it's complicated. The second thing is that there's still a real lack of education in the medical community about what tick-borne disease really is. Some of them, if you go, some of people might actually test for Lyme disease. Some people might, if you don't live in a quote unquote endemic area, they might say, well, Lyme doesn't exist in whatever state you're in, and not test you and completely, send you down a different pathway. Or, I can't tell you how the number of patients that I've been told or have been told that it's a psychiatric issue, like they're just crazy and they're, so you get gaslit a lot by the traditional medical community. And then even the more educated doctors that are aware of Lyme disease, they might not be aware of all the co-infections and other things that's going on with it. So I think a lot of the patients that are chronically ill are turning towards alternative modalities. Like functional medicine is really where a lot of people go, which is really focused on finding the root cause of disease. But unfortunately for patients, a lot of that's cash pay. There's a lot of variability in people's understanding. And so finding a good doctor that will really listen to you and dig deeper. If I wasn't the type A engineering personality, I would have never figured out that the root cause of Russ's illness was tick-borne, right? It would have been, it's Alzheimer's. The traditional medical community was like, come back in 6 months and we'll track your decline. That was what I was getting from traditional healthcare, right? And that's what a lot of people see. They get bounced from specialist to specialist. Nobody can find the answers. And then when everybody comes up blank, they say, well, maybe you should see a psychiatrist. And so that's one of the challenges. And I like to, tell people, it's like, you're not crazy. There is a root, yourself. You might not be an expert in medicine, but you're an expert in you. And something is wrong. And you just need to find a doctor who will dig and do the testing to really figure it out. And that's where we slot in at Galaxy, is like, okay, well, we're going to give you tests that will actually help you get to the answer, right? Because the traditional tests that are out there are really not they're gonna do a disservice to a lot of people.
So do you actually have the test now that actually can detect the pathogens?
So we do. We have direct tests for the top 3 vector-borne pathogens. So that would be the 3 that I've talked about. So Borrelia, which is the pathogen causing Lyme disease; Bartonella, which is often associated with cat scratch disease.
Mhm.
And that's one thing people don't realize, is they're like, well, I've never been exposed to ticks, or I don't live in an area with ticks. And I'm like, well, have you ever been exposed to cats? Because cats are natural reservoirs for Bartonella. And, a cat scratch, a cat licking an infected wound, a flea infestation, those are also high risk factors for the transmission of that bacteria. And a lot of people don't realize that. If you adopt animals, or you rescue animals, which I think is fantastic, but it's an exposure that you need to be aware of. And then the third pathogen is Babesia, which is a parasitic infection. And I think what we're learning in some of our testing is Bartonella and Babesia are more widespread than people realize. And so we have tests available for all 3. We have a urine-based test for Lyme disease, because Lyme doesn't like to be in the blood. So urine is actually a great matrix. And then we have a blood-based test for the common co-infections. And those are looking at where we use really high sensitivity techniques to improve the limit of detection and really get to really low quantities of the bacteria or protozoa, and we can report those, to the physician. So if you go to your provider, they just set up an account, and then they can order our testing.
Perfect. And so definitely. And so how do you figure the power of community driving change in the world of chronic illness? How is that?
I mean, I think most of the progress, if not all of the progress that has been made in tick-borne illness and Lyme disease, has come from the advocacy community, right? I think the government has not until recently really acknowledged chronic Lyme as an issue. There was a lot of debate previously, and for various reasons, that really acknowledging the acute stage of the disease, but saying that chronic disease really isn't a thing. I think if you look at how that's changed, it's a lot of private foundations that have been impacted, personally, generally, and people that have come together and raised funds because they know how devastating these diseases are. And they have funded the research, and they've funded the studies that have shown that these pathogens are prevalent in complex chronic cases, that these pathogens persist after the standard course of antibiotics. So just because you've been treated with 4 weeks of doxycycline doesn't mean that you're not still infected with Borrelia. And that has been definitively shown in animals. And that research at top universities has all been funded by advocacy groups and private foundations. And there's advocacy groups that are working with the government to lobby for more federal funding, because tick-borne disease research is way underfunded compared to other way more rare diseases like malaria and others that are not really a challenge in the United States as much as some of these tick-borne pathogens or vector-borne pathogens. And so I think one of the things that I always acknowledge is the silver lining of this whole hot mess that we've gone through with my husband and my family is that the people I've met on the advocacy side within the Lyme community are just absolutely amazing. I mean, these are people that are really dedicating whatever skills they have, whether it's podcasting or raising money or lobbying or research, and trying to figure out how to give back and how to change the situation for future patients, because what you go through is so devastating in a lot of these cases that they're really, people see a call to do something better. And so I think all of the work that's happened has really been through the advocacy community. And then fortunately, COVID was also a little bit of a blessing in disguise, because people understand now, and it's become more scientifically accepted, that an infection can lead to long-term chronic symptoms.
Yeah.
And so that opened the door at the government level for a term infection-associated chronic illness, and Lyme is one of the ones that constantly gets added into that fray, along with others, and that's really advanced the understanding in the scientific community, and now it's also permeating into the medical community.
Perfect. Nicole, this is fantastic. Such good information. I can't tell you because, I'm very sorry that you had this personal tragedy to get to better testing. But there's going to be somebody out there that's going to thank God for you, or a lot of people that are going to thank God for you. So if somebody needs to reach you, Nicole, how do they get you?
Yeah, so I think the best place is at our website, which is www.galaxydx.com. And that is, where we have information about our technology, our testing. If you're a provider, there's information about how to order. And you can go and figure out, what testing needs and what we offer to help in your tick-borne disease journey. We also are on Instagram and Facebook as, Galaxy DX, also LinkedIn. And then, my email at galaxynicole.bell@galaxydx.com. If, there's a reach out that I can help with personally.
Perfect. Thanks so much, Nicole. We look forward to having you on again soon.
Oh, thank you so much for having me.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcasts as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.